Okay, sorry about that. So you would take the top off of the little spike without contaminating it, without touching it, keeping it sterile. You touch it, I'm sure you'll fail. So once you got it, take it, put it in there. You can twist back and forth, get it down in there. Make sure this is rolled all the way down and locked so the fluid doesn't run out. Flip it over, hang it. Squeeze so some fluid can get in here, and then you will prime it. And prime it just means get the line filled with fluid. Get the line filled with fluid. So I like to do it slow. You let the tip drip into the trash can, and you don't want to do it fast because you don't want to lose a lot of the antibiotics. So do it slow, and that way you don't have a lot of bubbles in there either. So there we go. All right. So I roll that back down. You control it with the roller. How fast, the further you put it up, the faster it'll be. The faster it'll run. So take the cap off. I mean, the cap is already off. Go ahead. And you attach it to the port, the second port on the IV line. Now, you have to do your math. Actually, I'm going to take that off because you have to figure your drops out. And so, I'll take that off for now. Before I start this, take it off. Sometimes these things it's hard to come off. There we go. Okay, so I'll let that hang right there. And it says "2 grams in 100 milliliters of sodium chloride to infuse over 30 minutes. So it's already in minutes, so you don't have to convert. So 100, always the fluid, remember, the fluid divided by time times the drip. So 100 divided by 30 equals 100 divided by 30 equals 3.3 times the drip, which is 10. So 33.3. So you'll round that to 33. 33 drops a minute. Okay? the amount of fluid. Don't worry about the other numbers. It's the amount of fluid divided by the time times the drops, okay? So 33 drops per minute. So you would have to count for a whole minute, and you have to count the drops to get 33. So I'm going to open this up. Three, four, five, six, 7, 8. Let me see. Wait, 12 go. Up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 8, 29, 30, 31, 32, 33. Going too fast, slow it down. 1, 2, 3, 4. And we go from 8. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33. Slow it down a little bit more. 1. There you go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23. You have to speed it up, so you just have to, you get it. So act like we got 33 drops in there. Hook it up and leave it on a dial where you got the 33 drops. If you got it at 33 drops, do not move this. Leave it. So hopefully it'll be on a machine and you can ask the CE to come program it for you. You just tell her it's 33 drops per minute. Okay? So that's that. Okay, so we'll got your medications going. Let's see here. Okay, and what's your pain level on a scale from 0 to 10? Okay. Okay, so about a 5? Okay. Yeah, on the scale from 0 to 10, where 0 is no pain and 10 is extremely just unbearable pain. Yep. Okay. So we're going to, what I want to do now is I want to take a look at your stomach, your abdomen, and I'm going to listen to it and lightly touch it, okay? So I'm going to be looking at it to see what's on the skin, and then I'm going to listen, and I'm going to listen in 4 places, and I'm just checking your bowel sounds, and also I want to touch to feel and see is it painful or tender, you know, feel your muscles or whatnot. And also when I want to look at the shape of your abdomen, okay? So, let me see. So, my stethoscope. I'm going to pull the curtain and provide some privacy. Okay. So I'm going to pull this cover up. Okay. I'm going to pull this cover up because I'm going to pull your gown up. I don't want you to be uncomfortable or cold or exposed. Okay? And pull your gown up, expose your stomach. Okay. All right. So I'm looking at it. I'm just sanitize my hands. So I see this is the site where you had your surgery. And you got an ABD pad on there. Your drainage system. Okay. Your abdomen is flat. I'm a little jealous. Okay. Looks good. All right, so I'm going to listen. Warm that up a little bit. Should have did this before I put it in my ears. Okay. Left upper quad. Right upper quad. Right lower quad. Left lower quad. Okay, good. And now I'm just going to touch, okay? You let me know if any of this is painful or tender, okay? It's a little tender there? Okay. How about over here? It's okay? Just filling it all quiet. Muscles feel good. Okay. Looks good. Thank you. No teaching on assessments needed. You do an assessment, it's just an assessment. You document. You don't have to teach. The only thing you have to teach on is if it has management behind it. Respiratory management, oxygen management, muscular, skeletal management. All right, got your non-slip footies on. That's good. Okay, you comfortable? You good? Okay. So let's see what we have next ahead of us. So, vital sounds. Okay, so that's good. We got that out the way. Fluids, vital signs. So what we're going to do now is we're going to change your gown, and we will change your gown, and forgot to write my interventions on this page. Oh, and we'll put a cold towel on your forehead, okay? Now, and the reason I didn't want to change your gown before, I guess I could have did it, like, sometime, like after or before the vital signs, I don't know. But so I just didn't want to do it right now before I listen to your vital sounds, because if I would have had you up and moving around, then that would have affected the vital sounds. So we'll change your gown, okay? And if you could just stand over here, so just for safety reasons. Thank you. Okay, so we'll change your gown, okay? And the curtains pulled good. Okay. Cover you up. Okay. And down here. You guys try to get your setup. You can use anything. You see, I used a bottle the other day as a breathing treatment. Just use whatever. Just look at your assignments and whatever it say that the patient has going on, make it as real as possible. You know, I got a balloon for the Jackson Pratt. Just make it as real as possible. And I just hope this pays off for me Friday, Saturday, and Sunday. Okay, and I'll be right back with that cold towel, okay? I'm going to your bathroom and get it. You good? Okay. Comfortable? Okay, rails up, good. All right. Okay, so here's the cold towel. I'll leave that on you for about 15 minutes. If you want us to re-wet it, we'll re-wet it, okay? All right, and I'm just gonna sit here and jot down some notes, go over some things, okay? Trying to make sure. Oh, I'm gonna be looking at this a lot. So I ain't trying to forget nothing. I'm not trying to repeat one the next day. If I only got one on Sunday, I only want to do one on Sunday. Get out of there, get back, get on YouTube, talk to you guys, get ready to go home the next day. So I'm going to check your temperature again after this also. At this point, I would probably start doing some documentation on comfort, abdominal assessment, and I'm really done after this. I will record my intake and output, the drainage, the IV fluid, what went in, what she drank, the drainage, what came out, the output, what came out, and also record how much solution is in the IV bag. So document, and that's it. So for documentation on comfort, I would just document what she said makes her comfortable, which was put a pillow behind patient state, putting a pillow behind on the lower part of her back makes her comfortable. And then I use the comfort verbal rating scale to get her level of comfort, which was 4 out of 10. Patient stated she was comfortable during PCS, so I was asking her. So I gotta put this on here. In my last box, what I'm gonna put in there is to make sure I'm gonna put pain and comfort in here, to make sure I ask what's their pain level and comfort level to see if it changed, so that I can document before and after my before and after implementation, to see if it changed. And being that I would put temp in here too, being that I want to get a temp after she's done. So the things that I want to get at the end, I would put in that box also. And then the fluids, of course, and that's why it's good to pay attention to the report and jot down little. You don't have to spell it all out, but I would do abbreviations where, you know, I understand what I wrote. But anything I wrote in these boxes that I got to report, I know that I have to also include that in my documentation. So the more you listen and write, you don't have to try to write everything they say, but what's important, you want to write. So, you know, I know I gotta say what kind of fluids. I gotta say what arm the insertion site is in. You know, you get a lot of stuff in report, which tells you what you need to document on. So now I will get her intake and output, and get the temp and her pain and comfort level, and then I'm done. I would love to just get an abdominal assessment. Would I get abdominal assessment, vital signs, medication, and fluid management and comfort? I would love it. Ready? So next up, I'll do another one right after this. My son went to sleep in the swing, watching the lights on his swing, and then he has a mirror up there so he can look at himself in the mirror. And then I also, so you know, baby's attention span, they need to be doing something to keep it. So when he got tired of that, he was able to look up and look at that sensory video. Had the music playing on his swing. So he's asleep. So I gotta get as much done as I can. So I'll do another one right after this. So let me finish this up. So what I got remaining in my IV bag. Okay. I'm just looking at how they got this on here. 1, 2, 3, 4 to 9. But anyway, so I'll just make something up. I got rental 80 milliliters left. And you only drink 1 cup of water. Okay. So 250 milliliters of orally. This is out. And this is in. So you got remaining. So you got 20 milliliters went in. And then I checked the hat. You had 300 urine output. And let's see your drainage. $75. Okay. Now I've been here for 2 hours. So that's running at 125 milliliters an hour. So you got 250. I'll say it was, and it was 750. I'll say it was 750 milliliters left, because if it was 120, running at 125 milliliters an hour, and I'll just say 2 hours I've been here, then it should be 250 milliliters infused. So if it was 1,000, then it would be 750 milliliters remaining. So, okay. And, all right. So can you tell me your pain level now? Okay. It's still a 5. Okay. And then on a scale from 0 to 10, where 0 is no pain at all and 10 is unbearable pain. 5, okay. And your comfort on a scale of 0 to 10, where 0 is no comfort at all and 10 is extremely comfortable. Oh, okay. 6, okay. That's good. So that's some improvement. All right, so we got our fluids. maintain fluids. You drink some water. We did the assessment on the abdomen. We talked about pain and comfort, how to get comfortable. And now you mentioned that your abdomen was a little tender around the surgical site. Yep, that's understandable. You just had the surgery. So we can get you a pain pill. You do have pain pills. So whenever you're in pain, you don't have to lay here in pain. You do know that you can request a pain pill, right? Okay. So yeah, we'll get you a pain pill for that pain. And if you find a certain, sometimes repositioning helps with pain. So if you find a position that works for you, just try to move around and see if you could find a position that works for you that offers you some kind of relief from pain, okay? Or you turn on the TV and watch one of your favorite shows. I mean, that works for me sometimes when I'm dealing with any kind of issues or hurt or in pain or something. If I watch something funny on the television, I love comedy. If I watch something funny on the television, then that kind of takes my mind off of what's going on with my body. So, yep, you can do that. And as far as your fluids, you want to continue. You want to drink as much fluids to prevent dehydration, okay? And speaking of dehydration, what I would like to do is just do a quick assessment to assure that you're not dehydrated, okay? All right, so if you can just open your mouth for me. Okay, good. And the next thing I'm going to do is I'm going to just pull your skin at your clavicle level, and what I'm checking for to see if it goes right back down or if it stays up, okay? I'm going to sanitize my hands. Okay? Okay. And that's just checking your hydration status. So you can do that yourself too. You can get a mirror. You can look in your mouth and see if it's moist or is it dry, is your lips cracked or whatnot. And that can be a sign of dehydration. And you can pinch at your skin, and then when you let go, it should be like elastic, like a rubber band, and go right back to place. If it stays raised a little bit, then or a lot of it, then that means you're dehydrated and you want to get some fluids. Call your doctor. If you're here and you check it yourself, you push your call light, let us know, and we'll take care of you, okay? So you want to make sure that I almost forgot that and I would have failed. Yeah. So I use the and I got it in here. And my abbreviations is MT, which is maintain fluids, but the MT really means mucus and tugger. And I'm thinking just maintain the fluids. Gotta be on top of it. But that's why it's good before you leave to go over your notes before you leave out of there and say you're done. So we got that assessment, the abdomen assessment, comfort. The assessment with the comfort is asking, communicating. Okay, and I'll ask the nurse to get you your Percocet for your pain, okay? All right, so we're all done. I'll take the towel. And it was my pleasure working with you today. Once this get done, they will come and take this down for you. Like I said, it was a pleasure, and I hope you feel better soon, okay? So, your bedside rails are up. You have your car light. Your bed is low and locked. and you're all good. So, bye. So, you know what? Before I go though, I wanna I know the aide was gonna get it, but I wanna go ahead and check your temperature for my records, okay? What was it? It was 99.1. Okay. All right. Well, it's 99. All right. Thank you. Now I'm done. As you're walking out, just continue looking at your paper as you're walking out. Look at your notes, okay? Because I was looking in my box, my last box, my scab, and I seen temp. I'm like, oh shoot, didn't get my temp. Let me get that temp before I go. So that completes this third PCS. I hope this was helpful for someone. And I'll do it. I'm gonna do another one. Practice makes perfect. Okay. Thanks for watching. Subscribe, like, dislike, comment. Got any questions? Ask the questions. I'll answer them. I got a new phone today. iPhone XS Max. It's big, but I wanted a big phone because I have a son, and I didn't want a little phone because it's easy to lose, especially when you got a little kid. I wanted the big screen so he could watch YouTube learning shows on it. So anywho, that's that. See you guys in a minute. Bye.